Hello, my name is Christina, and I'm going to be conducting a presentation for Advanced Concepts Presentation 7. This is going to be a discussion of Lovastatin. So let's go ahead and discuss statins. Lovastatin is a drug that falls into the category of statins. Statins are known to effectively block cholesterol synthesis in the body. Other statins include atorvastatin, rosuvastatin, fluvastatin, pravastatin, and so on. Cholesterol is known as a contributor to the development of heart disease. When cholesterol is formed, it leaves the liver and enters the bloodstream and will form bile acid hormones and other endogenous chemicals. When excessive cholesterol is in the bloodstream, it can build up in the artery and form plaques. This buildup can cause a blockage in the blood flow to the heart or brain and can cause a heart attack or stroke. Lovastatin is also known as Mevacor. These compounds are potent competitive inhibitors of HMG-CoA reductase, the essential control point in the biosynthesis pathway for cholesterol. Statins are inhibitors of HMG-CoA reductase and are widely used to lower the plasma cholesterol level in people who have atherosclerosis. You can observe this image here showing lovastatin and mevalonate. This is the structure of lovastatin and HMG-CoA. So when observing this image, you can see that lovastatin has a similar molecular structure to HMG-CoA reductase. This is true of all statins. In this next image, you can see multiple different statins shown here and their chemical structure. So you can have a comparison with the HMG-CoA and the chemical structure of the other statins and how that plays a part in stopping the synthesis of cholesterol. So HMG-CoA, similarities in structures allow statins to bind to the HMG-CoA reductase enzyme and block it from reacting with HMG-CoA. Doing this will stop the formation cascade of cholesterol in the liver. Less cholesterol being formed in the liver means less cholesterol circulating in the body, which lowers the potential of plaque formation. This is cholesterol synthesis and how lovastatin plays a part in stopping this. So lovastatin, as we mentioned earlier, is structurally similar to the HMG. HMG is a substituent of the endogenous substrate of HMG-CoA reductase. Lovastatin is a prodrug. This means that it is activated once it enters the body. It is activated in vivo via hydrolysis of the lactone ring to form the beta hydroxy acid. The hydrolyzed lactone ring mimics the tetrahedral intermediate produced by the reductase, allowing the agent to bind to HMG-CoA's reductase with a greater affinity than its natural substrate. The bicyclic portion of lovastatin binds to the coenzyme A portion of the active site. And as you can see here, it is indicating right up at the top where the lovastatin will begin to play a part in ceasing the synthesis of cholesterol. So I always like to add a clinical portion of this just because this class correlates a lot with the medications that I'm constantly being exposed to, and of course under the supervision of a physician sending out to patients. So let's go ahead and discuss how this plays a part. So CT cardiac calcium score can detect the plaque in the coronary arteries that run along the sulcus of the myocardium heart. The main function is to supply blood to the heart. Having plaque in these arteries is an indication to a healthcare provider that you may need to be on statins or referred to cardiology for possible stents depending on the blood pressure, heart rate, and other symptoms. CT cardiac calcium score is important just because some people may have elevated lipids. Elevated lipids means high cholesterols in the body. They may have an elevated cholesterol of maybe 300. Now, there have been many cases where a patient has elevated lipids, elevated cholesterol, and when they do or complete a CT cardiac calcium score, they have a score of 0, maybe 9. Then there are people who have that really high cholesterol who do a CT cardiac calcium score that have a score of 2,000. The scores on these CTs indicate the amount of plaque that you have in your arteries, which, as mentioned before, plaque in the arteries can prevent blood flowing through the body, specifically to the brain as well as the heart. And this is where I mentioned here that they may need to be referred to cardiology for possible stents, because there have been many cases where we've had to send patients to cardiology because they are the specialists and they're the ones who need to take it from there. But I find it very interesting, and I know these medications front and back, but to know the structure, to know how they interact with the body, and to know when they contribute to a specific synthesis and how it ceases it from continuing on in the body, specifically for the cholesterol synthesis, gives me a better understanding when I speak to, or I apologize, when the physician speaks to the patient, I can understand a lot more of what he is discussing with them. So that is just a little bit on my end. Thank you for watching this, and I hope I did well.